I don't know. Are you on mute? Oh, okay. What light? It is on.
Hi, I'm Virginia Doran, hosting another episode for To the Point, generously hosted and produced by the American Acupuncture Council. Today, my guest is Brandon Horn. He's going to speak on the role of biofilms in the induction and maintenance of latency. And being that I live in a very tick-ridden area, I've come to learn a lot about biofilms, and certainly they influence other diseases, but I think it will be valuable for you across a host of different conditions that you might be treating. So Brandon is a real Renaissance man, and I can't even really get into all his bio, but you could go and see it at lotuscenter.com. He's been a senior student of Jeffrey Yuen for years. He has a doctorate of philosophy in classical Chinese medicine from American University of Complementary Medicine in Los Angeles. He's been a licensed acupuncturist since 2000. And he has many specialties: infertility, rheumatology, pediatrics. He's published in books and in articles many times and various subjects. And I think it'd be very interesting for you. He has a healthy seminars course on optimizing ovarian reserve. And there's really just so many things as he's done. I'd be talking for quite a long time to tell you all that. So without further ado, I would like to introduce Brandon. And if I left something important out, Brandon, please let me know. But otherwise, I'll hand it over to you, Brandon.
Okay,
Excuse me.
thank you. You hear me okay?
Yes.
Okay, great. So thank you, Virginia. And just want to thank you and the AAC for inviting me to speak with you today. I originally, as you know, had wanted to present some information on COVID for you guys, but I'm not allowed to because I was told that Facebook has decided to pull down people's accounts if they're disseminating information about COVID that's not from an official source. At any rate, I've been presenting a series on latency at the International Integrative Chinese Medicine Conference in Australia. And these talks are now available at aucm.online if you want to pursue today's lecture further. So I'll get into as much detail as we have time for, but there is a resource available if you want more. So we're going to talk about biofilms today, which is apparently not on Facebook's censor list yet. But biofilms are quite fascinating. And really, when you begin to study microbiology, you start to understand the details of what the ancient doctors were observing and what they've been describing for millennia. So, all right, I'm taking slides straight out of one of the talks that I gave called Managing Microbial Resistance. And again, this is available in full at aucm.online for those who want to hear the full lecture, because biofilms is only one part of the lecture. And I had to cut it down a bit to fit within a half an hour. So in that lecture, we're talking about latency, or lurking pathogens, as some people call them. And this is more from the perspective of bacteria in this particular lecture, because different pathogens have very different ways in which they form and maintain latency. And also our Wei Qi responds very differently as well. So from a big picture bacterial latency perspective, we have three major players here. These are the persisters, the persister organisms, the biofilms, and the antimicrobial resistant organisms. So these groups of organisms are all on a spectrum of latency that we'll look at in a minute. But first, I'd like to briefly review the origins of latency in Chinese medicine for those of you who are not necessarily familiar with the concept. So in Chinese, the term we use for latency or for lurking is fu. And this has been popularized or revived in some ways in TCM from the Wenbing school, right? But the origins of this concept of latency are much older than that. The earliest mentions go all the way back to the Meijing in chapters 3 and 5 of the Su Wen, which states that when one is harmed by cold in the winter, one will suffer a warm disease in the spring. So what that's saying is not that you really get cold in the winter and then you'll end up with a one bing in the spring. It's really giving us this concept that infection and disease are not the same thing, meaning that you can be infected asymptomatically. But that asymptomatic infection does not mean that you're off the hook, right? So this is important. It has very important ramifications with disease etiology, and particularly with how we approach diseases. So for example, in another topic that Facebook loves to censor, vaccination, we find that these vaccines are designed to induce latency, either immediately, which is in the case of live vaccines, or upon contact with a pathogen, as is the case with most of the other vaccines that we have. And we know, for example, that vaccinating, if you take, for example, pertussis, that prevents you, assuming that it works, it prevents you from becoming symptomatic with pertussis, but it does not prevent infection with Bordetella pertussis. However, what the Neijing is telling us is that you can contract the pathogen asymptomatically, but later on, you're going to manifest the disease in a different way, right? So pharmaceutical companies, they don't like to look for that kind of problem because it rains in on their profit parade. But fortunately, there are a few researchers that have noticed these kinds of problems and published about them, but bad things tend to happen to their careers. At any rate, as they say, trust science, but not necessarily scientists. All right, I'm done with politics. The second thing.
So could you give an example of that? You know, could you give an example of the of this latency?
Yeah, I'm going to give you lots of examples.
Oh, okay.
Yeah. So we're going to talk about a whole spectrum of latency in a minute. I have some slides on it. So, okay. So anyway, the second thing that it's telling us is that environment is primarily responsible for this change in pathogen from being asymptomatic to transforming into a disease, right? They say it's one thing happens in winter, the next thing happens in spring. This is environment. There are other things here as well in terms of discussing people's constitutions and things like that, but that's a little more involved than we have time for right now. Oh, sorry about that. The main point here is that Chinese medicine has understood this idea of a hidden pathogen or asymptomatic infection or subclinical infection, if you want to call it, for millennia. And so in Chinese medicine, Fu refers to any kind of infection that can hide or take on a dormant state or that can resist being expelled by the body. Now, so this gets to your question here a little bit, or it will. Now, from the Neijing, we can differentiate different kinds of latency. So there's latent cold, latent heat, latent damp, and latent wind. And then the One Bing school added really latent fire. But for this particular lecture, the most important are latent cold, latent heat, and latent damp. Really, latent fire and wind are all under latent heat, the yang factors, right? So at any rate, to give you some idea of how this is important, within microbiology, we have a kind of spectrum of what Chinese medicine really calls Fu. And these are, again, from latent cold to latent heat. And of course, in between cold and heat is damp, right? Where yin and yang meet is dampness. Now, what this spectrum is describing is both phenotypical alterations of the organisms. So this would be a cold pathogen transforming into a heat pathogen, for example, or it could be describing the environment that the pathogen is in. And these concepts are related, but when we're discussing biofilms themselves, we're talking both about the environment of the biofilm as well as the pathogen mix. So biofilms, as the earth element, contain the entire spectrum from cold to heat. So what exactly are biofilms? Well, biofilms are basically these kind of small fortresses, if you want to think about them, that pathogens build to protect themselves from our Wei Qi and to allow them to persist in our bodies without having to worry about the immune system. So basically, they are one of the main methods of latency within our bodies. And in my opinion, this is why Sun Simiao thought phlegm was a major part of disease. And he was right. It turns out that up to 60% of all human infections are believed to be caused by biofilms. That's all human infections. And 80% of bacterial diseases are believed to be caused by biofilms. And when we look at the chemistry of biofilms, we see that they're essentially, what they are is they're a matrix of biopolymers that are, as they say, highly hydrated. So in other words, they're full of water, right? So polymers are just like, technically they're a repeating chain of molecules. So it's kind of like if you take Legos and you just use the Legos to build, the same size, the same pieces to build a kind of more complicated structure. That's essentially what you have. And they're also, again, highly hydrated. And so you see that from a chemistry perspective, these biopolymers that make up the outer coating of the biofilms are indeed dampness, right? But polymers, of course, can be very tough substances. So like phlegm, so we think of so if you think some polymers, things like PVC is a polymer, right? Or even natural polymers like rubber or hemp and so forth. So they can be very difficult to break down. And one more point here that I want to make is that biofilms are made of what are sessile organisms. And that means that these are organisms that are attached to the biofilm. So when the organisms are swimming around, we call them planktonic, but these are just different phenotypes that the same organism can become. And organisms that are in this particular phenotype that we call a sessile state respond very differently to antibiotics and to the immune system than planktonic organisms do. However, almost all of the literature that you read about with this herb or that herb or this antibiotic or whatever killing XYZ bacteria, these are done when they're in a planktonic state and not when they're in a sessile state. So these may actually have no effect on the organism when it's expressing a sessile phenotype. So for example, in a biofilm. And this is another reason why it's really hard to kill biofilm organisms, or it can be. Okay, so here you have a couple of images of what biofilms look like close up. And you can see it really is phlegmy in some ways. So I like these images because it's similar to what you can feel in pulses or when you palpate, right? So a lot of what Jeffrey Yuen, for example, refers to as bands or some of these phlegm nodulations that aren't obviously lymph nodes or something, or these calcification type things, or what Kiko Matsumoto, if any of you follow her, calls gummies or crunchies. These are really, a lot of times, these are the effects of biofilms on tissue. And both Jeffrey and Kiko break these down, and they like to use moxibustion as well, which we have a slide on in a minute. Jeffrey likes also using gua sha. Kiko doesn't really use gua sha to my knowledge. So we saw the photograph of the surface of a biofilm, but inside the biofilm, it's a little different. So inside of a biofilm, we basically have three layers under the surface. So you can think of it as kind of like a three-story house or something, right, in some ways. So at the top layer, you have it's full of qi and blood, kind of like, like Yang Ming, right? And then you have the next layer that is high in substrate and low in oxygen. So that's the Shaoyang layer. That's where damp pathogens that have to use fermentation for energy, right, because it's low in oxygen, that's where those live, right, in that layer. And then finally, you have the third layer, which is low in substrate and low in oxygen. And this is where you have the persister cells, or what we call in Chinese medicine, these cold pathogens, right? So what you see here is that you get sort of multiple phenotypical states within one biofilm. And what that means, once again, is that it's really tough to kill, right? So even if you remove the surface and you expose the bacteria to the immune system or to antibiotics, then the persister cells are still going to survive, and eventually they're going to become planktonic again, and then they can reinfect you again. And this is why we need to think long-term. You can't just treat symptomatically, and once the symptoms are gone, then you stop treating. Because the pathogen is going to remain latent, and it's going to pop up somewhere else as a different kind of disease, or it can pop up in the same place as well. So you get rid of, let's say you get rid of the person's knee pain or whatever, but really you just release the pathogen, and then 6 months later it's growing on the person's neck or their spine, and then you end up with another kind of disease that you don't necessarily correlate with that. This is really a microbiological reality of divergent channel theory, if any of you follow Jeffrey Yuen or some of the other teachers teaching divergent channels. So to treat biofilms, we should first take a look at how they're formed, and then we're going to discuss a little bit of some of the approaches we can use to treat them. So With the formation of biofilms, of course, it's going to first start with adhesion, right? It first has to adhere to a surface. And once that happens, then it's going to attach and then grow the biofilm on it. So this first stage is really in the chi level because the initial adhesion is done through electrostatic or van der Waals interactions, which if you're not familiar with van der Waals forces, they're basically like what geckos use to stick to the ceiling or to the wall or something like that. But yeah, that's what they use. So at any rate, because this is the chi level, we can use chi to prevent adhesion. And so we can really look at things like qigong or like using e-stim. If you're not, if you think qigong is too esoteric for you, use e-stim, or you can alter the pH. Various pH altering strategies work. Hydration is also very helpful. All of this can disrupt biofilms from forming. I also have a list of herbs here as well. So things like green tea, which of course they use in Chinese restaurants to clean the grease off the glass tables, because it's really good at breaking down, dampness, right? It's also, there's cranberry, which is popular for preventing UTIs, and it also helps prevent the formation of biofilms as well. And also keep in mind there are different methods that different bacteria use to form biofilms. So these herbs aren't going to necessarily work on all biofilms, but certainly they do help with many different kinds. Okay, so then after we have the initial sort of adhesion, then attachment happens. So once they're together, then they have to start binding, right? So then they start physically binding, right? At any rate, once that happens, then that's what we consider to be more at the blood level, right? So we need to use herbs because it's something more structural, more physical. So we need to use herbs that break up blood stagnation or blood stasis to prevent formation at this stage or to break things down at this stage. So I just put up, herbs with studies here, but of course you can use the regular ones. Nattokinase is particularly effective for this stage, by the way. But you should be careful with that. Nattokinase is actually quite strong. Okay, so once it's anchored, then the bacteria start to collect on it. So they can we basically call that swarming, right? Everything just starts swarming towards it. And there's some herbs listed here that we can use to inhibit this sort of swarming function. And then as they're swarming and gathering into a community, then they need to communicate. So this is done by something called quorum sensing, which I discuss in detail in the main lecture. But here are a list of herbs that interfere with that process. So quorum sensing is also very important when we're dealing with antibiotic-resistant organisms, which are different than biofilms. And these require different strategies than just dealing with biofilms. So then we have the outer coating, the EPS, so inhibition of the formation of EPS. So these are some strategies for breaking down the biopolymer or the phlegm, as we discussed. So again, I know all of you know which herbs treat phlegm in Chinese medicine. So I only listed herbs here that have studies on them directly inhibiting the EPS formation. But of course, you can use other herbs that deal with phlegm as well. And finally, after the biofilm is formed, it eventually gets too crowded, and at some point it bursts open, and we call that the dispersal stage. So it can be stimulated also by environmental factors like extreme temperatures, pH extremes, dietary changes, and so forth. So of course, saunas can cause dispersal, as can dietary supplements, and of course, herbal medicines can as well. And so this is one of the prime causes of the so-called healing crisis, where all of a sudden these latent pathogens get released, and then you need to deal with them. They're no longer latent, they're spreading. Again, this is divergent channel theory, where if you've studied with Jeffrey Yuen, he talks about how you have 2 or maybe 3 approaches when you're dealing with chronic pathogens. And one is the maintenance, big general approaches. One is to maintain latency or induce latency, and the other is to stimulate the pathogen to come out of latency and then expel it from the body. Now, of course, it's very difficult to permanently rid yourself of the pathogen, but it can help to reduce the pathogenic load on the body if it's using too many resources to maintain latency. So you only have so many jail cells, so to speak. And if you don't clear out your jail cells, there's not going to be any room for new criminals that are coming in, right? So, I mean, that's really kind of how it is. So here are some herbs and so forth here that I've listed that can help inhibit dispersal. And some of these actually are counterintuitive because traditionally we've used cold to maintain latency, but here you see garlic and onions and cinnamon bark. Those can inhibit biofilm dispersal. Of course, these studies, keep in mind, these are usually done in vitro, meaning in a test tube or in a petri dish or something. And it can behave very differently when it's in vivo or when it's in the body, right? So for me, when I'm trying to inhibit dispersal, which may be if I know my patient is going into some extreme conditions, or if they're going through something really stressful, or maybe they're having a current healing crisis, then I don't use garlic. I'm recommending things that are cooling and cold. So from here, you could see things like cactus and apples and leafy greens and so forth, things like that. Of course, cinnamon bark you can use in small doses to actually, pull things back into latency, but that's, that's another discussion. In general, as a general concept, cooling and cold is what I use, like the Liu soup for those of you who've studied some of the classical medicine. Yeah.
Brandon, do you recommend the patient do things to kind of open the detoxification pathways, something like glutathione or something, so that their detoxification of whatever they have makes it easier, a smoother, less cathartic, less, herxomer reaction and all?
Yeah, so I actually, I don't go there right away. So this will be sort of an individual thing for each patient, but as a general proposition, it's not actually, a lot of people like to detoxify, but that's really usually not in my opinion, that's not the correct strategy to start with. The correct strategy to start with is to make sure that all of your exits are open, right? So you want to make sure that the person's bowels are moving well. You want to make sure that their urination is going well. They're able to sweat, these types of things, because you can do as much, detoxification as you want. And that's just like taking a bathtub and trying to clean it without much water. You're just or without the drain being open, even if you have water, right? You're just going to swoosh it around and it's not really going to do much. So you first have to make sure that all the exits are going smoothly. So if the person's constipated, or they have dry stools, or these types of things, then you need to correct. I recommend correcting that first anytime you're doing any of this stuff. And then you can get in if a person needs glutathione or a person needs whatever. I am actually, as much as I talk about all this Western stuff, I am at heart an herbalist and acupuncturist first. And that's always my go-to initially. And I do functional medicine types of things and types of testing. I do it frequently, but these are things that I do for people where it's more remote oftentimes, so I don't have to check their pulses necessarily, or I can use it also as a, if what I'm doing in the herbal medicine isn't working well enough for the person's sensitive. So that's kind of how
I think we're actually saying the same thing. Yeah, the glutathione just opens up the liver so that it can detoxify more smoothly, but anyway, yeah, it's just interesting to hear your approach.
Yeah, exactly. So you can open up the liver, but it still has to get out of the body, right? So that's all I'm saying is that I'm sure you would agree. You're a student at Jeffries too. You know that this is, you're assuming step one is done. So, so for treatment then of biofilms, since that's this slide, we can talk about that a little bit. The approach then. So this is just kind of a general idea of where you first ensure that the body's strong enough to handle the breakdown of biofilms and this release of latency. And then next you attack the matrix, right? So after the person's strong enough, then you go after the matrix of the biofilms, and you can use some of the strategies that we talked about that cause biofilm dispersal, like saunas or jumping into a frozen lake or getting beaten by a tree branch. These are the kind of Russian methods, but at least there's a sauna at the end, so that's good. And then finally, you need to sort of clear the pathogen out and then loop back to step one until you no longer get symptomatic after step two. So you're going to keep going through the cycle. That soon the symptoms over time, they're going to be less and less as you're clearing things out. So let's take a look at the different stages. We're actually not going to talk much about the first stage because that's just standard TCM. Pretty much everyone is trained in how you strengthen the body, the chi and blood, and make sure that they're strong enough for this. So then the second thing is that we're going to attack the matrix. So other than the environmental manipulations that I just mentioned, we work primarily with the 8 extra channels on this and the low channels for this stage. And really, if you're looking at biofilms, low channels are the primary way to treat these because biofilms, again, as we mentioned, they're most oftentimes present as phlegm and as blood stagnation. And the channel system that deals with phlegm and blood stagnation are the low channels, right? So you can use gua sha on the banded areas, or you can use needles and moxa to break that down. Those are also very effective. From the 8 extra channel perspective, we work with yang wei mai as the primary channel. And then secondarily, then we can work with dai mai and yin chao. And if you need some of that extra power or whatever, then possibly you'll tap into du mai as well. But it's more the dai and yang chao for this. So now, as I mentioned moxibustion before, so here's a slide on that. It's very useful for breaking down biofilms. And there has been research in this area in terms of temperatures, not in terms of moxibustion directly, but in terms of temperatures that biofilms begin to break down with. So then we can look at what temperature the moxa gets up to, right? And this, of course, is going to also depend on the blend that you're burning. So you can check the temperatures if you want with, those laser thermometers if you're a metal type. And you need to have those exact numbers. But basically, you want the area of the tissue that you're trying to break down to hit 50 degrees centigrade, which is about 122 degrees Fahrenheit. But for me, I use centigrade for this, not to be fancy, but just because it's easier to remember. So I use that. So 50 is your target for biofilm breakdown, and 60 is where your skin burns. So the sweet spot is between 50 and 60 degrees Celsius. And as you can see here, moxibustion can get you there. But keep in mind that the temperature at the surface of the skin is not the same as the subcutaneous temperature. So what I find to be the most effective personally is using Kiko's style of doing direct moxibustion on the needle itself. Meaning that you insert the needle and then you're putting the moxibustion at the border of the needle and the skin, right? You put a little burn cream on there for those of you who aren't familiar with that, and then you do the small rice grain moxas on top and keep going. If you use needle moxa, what happens is it typically is going to cool off too much by the time it gets to the biofilm, unless you're using a particularly hot moxa formula or you're burning it for a particularly long time, then you might be able to get it up there. So I'm not going to discuss clearing the pathogen so much because that's, there are many ways to do that. I tend to use low channels a lot. I tend to use that really the most for clearing. And herbally, once these things are active, you can use your standard things, your Shanghan Lun formulas or one Bing strategies, depending on what you're trying to do at that point. So here in this slide, I just wanted to bring up this caution that when you release latency, it can spread and it can cause widespread problems that can be serious. And as you see here, it can disseminate into the blood, which means that it could cause sepsis, right? If the patient isn't strong enough to clear it out. So again, my recommendation is to go slowly, but sometimes, we don't have a choice because someone gets sick, someone gets a fever, and then bang, it starts to cause dispersal of biofilms. And these are where you get a lot of secondary bacterial infections to a primary viral infection, like say a cold or flu, or that other thing that shall not be named that some people are taking azithromycin for. So if you're aware of this, then we can employ some of the acupuncture and herbal strategies as prophylaxis. Now, some of the practitioners, particularly naturopaths or some functional medicine practitioners, love to use a lot of anti-biofilm substances. And I would really caution against being overly aggressive with those, because unless you know how to monitor pulses, again, you're only going to know something is happening otherwise if the patient's symptomatic. But these things can spread asymptomatically as well. And then they can go places that are less than ideal, right? Your body put them in a particular place, perhaps on purpose, and then then they can start spreading to places your body didn't want. So if you check pulses, then you're much less likely to run into a problem. But if you don't check pulses, then I think it's best personally to err on the side of just moving slower to release the latency. So again, these are all citations to articles in the NCBI. So you can follow up that, yes, fever-induced biofilms do release pneumococci. And this has been shown to result in bacterial dissemination and sepsis, for example. So this is not just Chinese medicine talking. This is also, what's been confirmed in medical research. I mean, non-Chinese medicine medical research. I personally rely more on, I think Chinese medicine vertical research is much more accurate, but that's a whole nother discussion. So lastly, I just want to mention that biofilms are everywhere in our environment. They're on your showers, they're in your, they're all over the place, everywhere, and also everywhere in our bodies. And some of them are actually beneficial. So just like if we take too many phlegm-resolving herbs, we can damage our yin. If we remove biofilms too aggressively, we can end up compromising our health rather than helping it. So here is one example of biofilms throughout the lower jiao that protect the body from other pathogens. So here you see the lactobacillus form a thick protective layer, the biofilm basically, in the female urogenital system that provides protection against bacterial infections, and the vaginal cells are completely covered with healthy biofilms, and that's a good thing. So I think that's pretty much it. And then for the full, what's that?
That's great, yeah.
Okay, yeah. And so I just want people to know that the full presentation is available, talking about the persister organisms, a little more detail on biofilms, but also talking about the antibiotic resistant organisms themselves and how to approach those. That's available at aucm.online. And it's only 3 hours, so it's not like you have to watch it for 2 years, like some of my other ones.
Okay, well, I want to thank you all for tuning in. And next week, the guest will be Yair Maimon, and he's always interesting. And again, thanks to the American Acupuncture Council. I'm Virginia Doran of luminousbeauty.com, and we'll see you again soon.
All right, thank you.
Thank you, Brandon.